Okay, ready to go? Okay, on Thursday and Friday, the Government Operations Committee, of which I'm a member, spent 2 days in Canada. We were both in Ottawa and then in Toronto, meeting with a wide variety of people so that we could better understand the strengths and weaknesses of the Canadian healthcare system. The trip involved 10 members of the Congress. There were Democrats, Republicans. John Conyers, who is the chairman of the committee, was there, and I think it was an important meeting. Let me make some very brief observations regarding what we saw and heard at that meeting, on that trip. Number one, I think what surprised all of the members is the degree to which the Canadian healthcare system is extremely popular in Canada. And it, in fact, is an institution that the Canadian people are very proud of. Poll after poll shows widespread support for the Canadian concept of a single-payer, universal, comprehensive healthcare system which guarantees healthcare to all of their people without out-of-pocket expense. The Canadian healthcare system has the strong support of all of the three major political parties in Canada, including the Conservative Party of Prime Minister Mulroney, who is now in power. As we learned on our trip, meeting with representatives of different sectors of Canadian society, it also has the support of the Canadian Medical Association. That was not always the case, but now, by and large, the doctors are in support of their system, trade unions are in support of the system, consumer groups, low-income groups, and virtually every element of Canadian society. The Canadian healthcare system is a program that nobody in government, nobody in politics, tampers with in any substantial way because of the wide support that it has from the people. The groups that we spoke to gave a wide range of opinion as to why they liked their healthcare system, but the reason most often heard was the simplicity and the universality of their system. In Canada, a citizen can go to any doctor, any hospital he or she wants to go to, and all the patient has to do is take a card out of his or her pocket, you give it to the doctor, you give it to the hospital, and that is the end of the billing process. You have absolute freedom of choice. Any doctor, any hospital, you go in, you get all of your health care needs taken care of. You don't have to fill out a wide range of forms. You don't have to fight with your insurance companies. There are no co-payments. There are no deductibles. And that is a feature of the system that is supported and enjoyed not only by the patients, but by the physicians and the hospital administrators alike. For the patient, the advantages are obvious, but for the doctor also, the advantages are manifold. They don't have to worry about billing patients. They don't have to hire people to fill out bureaucratic forms. So that aspect of the system is very popular and widely supported. Number two, from the point of view of total government spending, Canadians that we met liked their system because, in fact, it is far more cost-effective than our system is. Our system, which we must remember leaves 85 million Americans either completely uninsured or partially uninsured, ends up costing us 40% more per capita than the Canadian system, which provides comprehensive care for all of their people. So when we talk about all aspects of the Canadian versus American system, you're not talking about apples and apples. You're talking about apples and oranges. We are spending 40% more than are the Canadians. And we should point out, of course, the Canadian system is expensive. But we spend $2,354 per capita, the Canadians $1,683, and of course in Europe the systems are actually more cost effective. The reason that the single-payer Canadian system is more cost effective is for a variety of reasons. Number one, the Canadian single-payer system eliminates the vast insurance bureaucracies that exist, especially in our country when you have 1,500 competing private insurance companies. And this chart just gives you an indication in terms of the hospital building and administration in U.S. and Canada. We're spending $162 per capita. They spend $50 per capita. So that's one of the reasons their system is more cost-effective. The General Accounting Office suggested that we could save $67 billion a year by moving toward a single-payer system. Physicians for National Health Care estimated $100 billion. That's a savings that the Canadians receive that we don't receive. Second of all, the Canadians can run a more cost-effective system because with a single-payer approach, they are able to negotiate. They're able to negotiate doctors' fees and provide global budgeting for their hospitals. Each province in Canada negotiates fees with its doctors, and basically that fee is all that a doctor can charge for a given procedure. Do you want to know how much a medical procedure is going to cost in Canada, how much a doctor is going to charge? Here is the Ontario list of fees, and that's it. A doctor cannot charge more than is in the fee schedule. In general, the costs of medical procedures in Canada are far, far lower than in the United States. In 1987, in fact, Canada spent 34% less per capita on physicians' services than did we in the United States. On the trip, I spoke with a friend of mine, a congressman from Minnesota, who recently had been in Manitoba examining their fee schedule. He noted that many of the fees charged in Manitoba were 25% of what they had been charged in Minnesota. Further, the Canadian government, through their single-payer approach, has managed to get a much better handle on the high cost of prescription drugs, which is a very, very serious problem in our country. Cost of prescription drugs are going off the roof, hurting many of our citizens, including senior citizens. According to figures recently published by the United States Senate, the average American pays 62% more for prescription drugs than the average Canadian and 54% more than the average European. This chart over here, in fact, does not include Canada, but you can see that the United States is paying far higher prices for the same prescription drug than is the case in Holland, Germany, the UK, Belgium, and so forth. We pay far and away the highest prices for our prescription drugs, many of which, I should point out, are manufactured in the United States. The Canadians have a much better handle on that than we do.
Any idea where they'd be on that chart?
I don't. But we, in fact, are paying 62% more, so we could figure it out. Probably somewhere around here.
Yeah, they would be a little higher than most of the...
Yeah, they are. That's right. Thirdly, in terms of the reasons why Canadians like their system, I think one of the arguments for it that we heard very strongly is that the Canadian system is a one-tier system which treats all of their people, rich and poor alike, in the same way. In other words, in Canada, you don't have health care programs for the poor. You have the same quality programs for the rich and poor alike. And I think that sense of egalitarianism is something that they are very proud of. We were at the Toronto General Hospital where we toured, and there was a young man, a worker, who had recently suffered a heart attack, and I think was very proud of the fact that he was getting quality care, the same care as the wealthiest people in Canada might receive. Fourthly, we hear some discussion in the United States where people say, and some of the Republicans who were on that trip with me were saying, well, you know, we're not saying that the Canadian system is bad. It's certainly good for low-income people, for working people, but, you know, in general, does it provide the same quality of care on the average than the system in the United States does? Now, quality is a hard question to judge, and the best that I could tell you is that speaking to Canadian physicians, to Canadian officials, many of whom had already practiced in the United States, their feeling was that the quality of care in Canada was as good, if not better, than in the United States. And clearly, in terms of a variety of health indicators, statistics relating to infant mortality, to low-weight babies, to longevity, how long people live, in fact, the Canadians are doing significantly better than we are doing in terms of those statistics. Having said all of this, and having suggested to you that the Canadians themselves are very proud of their system, feel that it is a very good system, do the Canadians feel that their system is perfect? And the answer, obviously, is that they don't, and in fact, far from that. They have many concerns about their own system. And in fact, the concerns are escalating, are intensifying, because Canada, as is the case in the United States, is currently undergoing a severe economic recession. Public money is hard to come by. The federal government has cut back on the amounts of money it provides to the provinces. The provinces are under tremendous pressure, as are the states in our own country. So the problems in the system are being looked at very carefully. Some of the problems that was indicated to us is that while Canada is doing a better job than we are in controlling the escalating cost of healthcare, in fact, healthcare costs in Canada are going up much too high. They want to cut back, and they're looking at a variety of mechanisms to see how they could cut back on the increase of healthcare costs. There is also a concern that in certain non-emergency type procedures, waiting lists are in fact too long, and they want to shorten those. Those are some of the concerns that we heard about the Canadian system. Let me conclude simply by saying that, as many people know, in 1944, almost 50 years ago, Franklin Delano Roosevelt told the American people in a State of the Union address almost 50 years ago that he believed that all Americans should be entitled to the health care they need, whether they are rich or whether they're poor. In 1948, Harry Truman ran for President of the United States, talking about national health care. Now, it seems to me that the time for talk must finally come to an end, and the time for action must begin. And when we compare the Canadian system to the American system, one point that we must make that is not made very often is that when the Canadians brought about their system, they brought it about because there was the political will to take on the insurance companies who fought vigorously against the single-payer concept in Saskatchewan. And they had the courage to take on the doctors who went on strike in Saskatchewan. They didn't like the system, but they had the courage to say that a national healthcare system for all people is what we want. And they took on the insurance companies, they took on the medical societies, and they won. They won. And now the challenge, it seems to me, for this President of the United States, for the Congress, is to see, do we have the courage, the political will, to take on the insurance companies, the drug companies, the physicians, the AMA, the medical equipment suppliers? Because ultimately, my friends, what we are talking about is not a healthcare battle. We are talking about a political and economic struggle. Right now, in a healthcare system in our country, which is deteriorating, which is falling apart, the insurance companies, the drug companies, certain physicians are making billions and billions of dollars in profit. Do we have the courage to stand up to these people and say, sorry, we can no longer continue in that vein. We must have a single-payer system for all of our people. That's what the struggle is about, and I intend to play an active role in bringing that about. Thanks very much.
Well,
Yeah.
you've said a lot about the flaws in the system. You mentioned them, but certainly if people have to wait for health care, be it an emergency or elective, that's a pretty serious issue.
Bridget, it is a serious issue. But I think if you understand that in our own country, what studies have indicated is that 30% of our own people delay and wait to go to the doctor or to the hospital because they are unable to afford the cost of those procedures. That must be taken into account also. Also, I think what should be said, and there was an article in the Montreal Gazette, which indicates that as the fight over national health care intensifies in this country, you're going to hear more and more horror stories, not only about what's going on in Canada, but what's going on in Europe. And these horror stories will be perpetuated by the insurance companies and those people who are opposed to a national health care system. And I think what the evidence is that many of those horror stories are exaggerations of the problems that exist. For example, I know in terms of just reading an article in the paper, a doctor there, a Canadian physician, who is critical, I should tell you, of the Canadian system, argues, quote, that there is virtually no truth to stories about masses of patients crossing the border for surgery in the United States. In the 1990-1991 fiscal year, only 350 Ontario heart patients, that's out of 10 million people in that province, had cardiac surgery in the United States, fewer than 5% of the almost 8,000 patients operated on in Ontario. And in fact, they've improved that. So I'm not going to deny that there is a problem. But if you understand that in our own country, 30% of the people delay going to doctor, delay going to hospital, because they just cannot afford to pay the bills, put that within the context. The problem about waiting is in fact more serious in this country.
Did you get to talk to any residents? I know you talked to doctors and other government officials, but what about the people? Did you have any interaction at all with patients?
Well, actually, being politicians, the 10 of us being politicians, when we were out on the street, we did, not in any scientific way, but we stopped and talked to people out on the street, people in shops and so forth. And we just, in general, said, how do you feel about the Canadian system? And while I do not want to suggest that we did an intensive poll, the people that we talked to were very proud of their system and very supportive of their system. In fact, many of the Canadians, if you ask them, they find it hard to believe that our system is allowed to continue, where people become nervous wrecks worrying about how they're going to pay their bills, where enormous numbers of bankruptcies in our own country, personal bankruptcies, occur because people have to spend everything that they have in order to pay their doctor bills and their hospitals. But I think what more than the question of the people that I talk to, what poll after poll suggests is that in Canada, their system is widely supported by their people. What poll after poll suggests is that in our country, the people want fundamental changes within our healthcare system. That the evidence is very clear about.
As you know, people are saying now that we can't do this overnight. What kind of timeline are you looking at? Do you agree with that?
I think that, in fact, the argument that we can't move quickly is that it would cost us too much money. I would argue that by delaying movement, we are ending up wasting a lot of money that could be saved through a single-payer system. I don't want to shock the viewers. I am taking the conservative position on this issue. I do not believe that we need to spend in our own state any more than the $1.3 billion we're presently spending on health care. Now, for example, this year, while the legislature and the Congress are arguing, should we raise any taxes, should we not, right? Very quietly, in our own state of Vermont, I would estimate we're going to be spending an additional $130 million a year on health care. That's what we're spending. I don't think we should spend that. And I think the only way we can really control the escalating cost of health care is through a single-payer system which controls doctors' fees, global budgets, hospitals, deals with the drug prices. That's the only way we can do it. So to argue that we can't move to single-payer because it costs too much is, in my view, absolutely wrong. Any other approach costs too much. The only way we can put a lid on health care spending and make it cost-effective, at least as cost-effective as it is in Canada, is through the single-payer system. So I reject that argument.
Bernie,
Bridget, why don't you finish and I'll go to you, RJ.
I was just going to say, but I don't think it is just money that people talk about. Certainly that is a major issue, but there are other things that people, Vermont lawmakers are talking about, that there are too many questions that are unanswered. There are ethics involved here, how you would work out a system of paying the doctors, what services are going to be provided, what services are not.
Bridget,
going to be
one of the advantages, I think none of us are very proud that the United States of America today is one of only 2 nations in this world without a national health care system. I think none of us are proud of that. But if there is any advantage of being virtually the last country in the world to move toward national health care, is that we have the opportunity to learn from all of the other countries. All right? Is it a mystery as to how you can negotiate doctors' fees? I don't think so. Every province in Canada does it, and they've been doing it for 20 years. I think what the real issue is not, gee, we don't know how to do it, gee, it's very complicated. No, I don't think so. I think what the issue is a political struggle. To get national health care in Canada, they had to fight and stand up to the physicians, they had to stand up to the insurance companies. That's what the issue is. And in our own country, in our own state, if you're not prepared to make that fight, then you're not serious about health care reform. I don't think it's a complicated issue. I think it's a heavy-duty political issue.
Bernie, is your single-payer plan single-payer to the states?
Yeah.
Okay.
RJ, in fact, in many respects, our plan models the Canadian system very strongly. And I was proud to find out when I spoke to some of the Canadian officials that they believe that their system is working as well as it is because it is administered by the provinces, not by their national government. And I think most people should understand that. So while we can say that there is a Canadian national health care system, what we should also say is that each province system is a little bit different. The benefits, the way the money is raised is a little bit different within each province, and that's consistent with Canadian law. The legislation that I have proposed in Washington does exactly the same thing. It says that if a state is prepared to have a single-payer system, comprehensive, covering all basic health care needs, universal, covering every man, woman, and child, that state then can move forward and get additional federal help on top of a block grant of Medicaid and Medicare. I think the Canadians feel that that's a positive direction, having the program administered, if you like, locally rather than nationally.
How much does your plan jive with the Senate Democrats' Help America plan that just came out?
In my view,
Is there
the
anything that-
position that is being brought forth, there's a split within the Congress right now. The Republicans, I think, have nothing serious to offer in this debate, and have only come out with a program because they know that the American people desperately want the government to deal with the issue. They've come out with something. I don't think it's significant. The Democrats are split. I would estimate that 25% of the Democrats, at least in the House, are supportive of a single-payer concept. A majority are not. The others are going along with what we might call the Kennedy-Mitchell approach, which is a pay-or-play approach. I think that the pay-or-play approach is a very weak effort to deal with this problem. Primarily, it focuses on those people who are uninsured, which is something, but it is not dealing with the fatal flaws of the whole problem in terms of the wasting of an estimated $100 billion through the continued existence of 1,500 separate insurance companies. So what the Democratic proposal will end up doing is, number one, costing taxpayers tens of billions of dollars more, costing small employers substantially more money, and when it's all over, what do you have? What you will have is a situation where, at the best case scenario, all Americans will have at least some insurance. That's okay. But you'll have tens of millions of Americans who will continue to have not particularly strong insurance programs. They will have co-payments. They will have deductibles. They will not have what the Canadians have, which is a comprehensive program without deductibles or co-payments. So I am not sympathetic to the Democratic plan. And what I think, I must say, is kind of sad in a way, is, as you may remember, 20 years ago, Senator Ted Kennedy of Massachusetts was talking about a single-payer Canadian plan. And if you speak to Kennedy, as I have, I've been on a panel with him, what he says, quite frankly, is that the single-payer plan is preferable to the pay-or-play concept. What he says, and what many people say, is unfortunately there is not the political will in Washington to bring the single-payer system forward.
Bernie, what about Senator Leahy's plan? Is that, he was talking about, setting up the states as a laboratory. He's in central Vermont today, trying to gain support for his bill. Should you guys be working together on this? Would that help at all, or is it two separate schools of thinking?
No, it's not two separate schools of thinking. What I am suggesting is that, to my mind, the only cost-effective way, the only way that you are going to provide quality health care to every man, woman, and child without out-of-pocket expense, create a situation, as in Canada, where people can go forward and get all of the health care they need without co-payments or deductibles. The only way that that can be done is through a single-payer system. That is what I believe very strongly. A minority of us in the Congress believe that. Now, secondly, what I also believe is that program should be administered at the statewide level, not at the national level. As I understand Senator Leahy's proposal, he is suggesting that the states have the flexibility to go forward in any way that they see fit. That is a step in the right direction, because I would like to see that as well. What differentiates our two plans is that I am prepared to give a financial incentive to those states that go forward with a single-payer system, because I think that the evidence is overwhelming that single-payer is the only way you could have quality, comprehensive care to all people.
My understanding of his bill did give incentives to the states.
He gave, I believe, some study money to states.
$1 million federal grant, and then you have incentives.
Yeah, and that's fine. I'm not familiar with all the details. So to the degree that he suggests that the state should go forward, I support that. My program suggests that clearly the only way that you can have universal comprehensive care is through a single-payer system. Now, for example, in Oregon, as you may know, there is a lot of discussion about a concept in which the state of Oregon would take their Medicaid money, spread it out over more people, broaden the lines, raise the levels by which people can participate in the program. But by doing that, what they're going to say to low-income people is that certain medical procedures may not be available to low-income people. They're saying, if you're wealthy, you can get the best health care you want. If you're poor, you can't. Is that the type of statewide program that I would support? It is not. It is not.
So you would like to see this done in one big swoop? I mean, you support the demonstration project, but your bill calls for this to be done
Right.
in every single state.
That wants
I
to
mean,
take
have this
advantage.
national
Right.
policy.
In other words, what we are saying very clearly is that we think it best that the programs be administered by the states. We think that that is the most cost-effective way. We think it's right that the people remain closer to the process. I'd rather have people be able to argue with Montpelier than Washington, D.C. But, on the other hand, what I'm saying is that, in my view, and in the view of many medical economists, the only way you're going to have quality, comprehensive, universal care for all of our people is through a single-payer system.
Right, but my point is, do you support, states doing it, say, one by one?
Yes.
Type of thing, or do you want every state to have to adopt a single
No.
payer, then it be done, or say Vermont decides to, New Hampshire,
Right. No, in fact, to answer your question, the legislation that we have proposed would enable states to go forward at different periods of time. In other words, my hope and dream would be that Vermont, in fact, would lead the country and go first with a single payer. Now, as you may recall, in Canada, that is what happened. They didn't end up with a national program all at one time. It started in the early 60s in Saskatchewan, and it worked there, it spread throughout their country. I believe that if Vermont, if California, if Michigan go forward this year, next year with a single-payer system, I think every other state in the country will start looking to those states and say, hey, if they've got it, we want it, let's move forward. And what you will end up eventually, in not so many years, is 50 states having that program with minor variations. So to answer your question also, on a political level, what I know is that at this moment there is no way that the President of the United States and the Congress are prepared to even move forward with 50 states. They can't do it. So my hope is that the concept of single payer, state by state, will catch on, because for political reasons, you'll have many people saying, well, okay, I don't want to do it for the whole country. If Vermont wants to go forward, if California, Michigan want to go forward, let them do it. Let's learn from that.
So your difference with Senator Leahy is that he would provide, that the government would provide the incentives for demonstration projects, regardless if it's single payer, whatever the reform may be that the state is
I
undertaking.
honestly don't want to talk too much to Senator Leahy's plan, because I'm not all that familiar with it. I know he's providing some planning money. But essentially, we believe that the only way you're going to have the quality and comprehensiveness and universality that we need is through single payer, such as the Canadians have.
Governor Dean is concerned, not so much the single payer, but maybe a limited payer, like 3 or 4 payers in the state of Vermont. I guess there's some 15 companies now, but people are used to working with certain companies. If it was limited, there was a state authority, a cost control, would you have any problem with that?
I don't want to get into great detail on that, but just to make the following point. All over this country now, there is tremendous discussion regarding the healthcare crisis. And as some of you may know, this is an issue I personally have been talking about for the last 20 years. I'm delighted now that it has risen to the level by which the Congress and governors all over this country are dealing with it. But let us be clear about the differences within the different programs, because everybody is talking about national health care. Everybody now is for national health care. So we should be clear about what we mean by national health care. And it is not complicated. Is cost containment important? Of course it is. Is it important that those 15% of Americans and Vermonters who now have no health insurance get health insurance? Of course it's important. Very important. But what I'm talking about, what Cheryl Rivers is talking about, is something different. We are not talking about a program for poor people. We're not talking about helping poor people. We are talking about a major changing of the structure of American healthcare delivery. We are talking about a single system for rich and poor alike, which guarantees healthcare to all people without out-of-pocket expense. That's the underlying point. In other words, I fear that under Governor Dean's plan, under the plan being pushed by the Democrats, under the plan being pushed by the Republicans, for most people, nothing changed. Nothing changes. They will still have large deductibles. They will still have cost containment. They will still have large co-payments. We would hope that maybe we can control the escalating cost of health care. But ultimately, for most people, things will not change. Our program will change things for all people. They will be able to go to the doctor, to the hospital, any hospital they want to, present their card, get all of the health care they need, and the substantial savings take place in the areas that I showed. They take place because physicians will not be able to charge anything they want, because we'll be able to save $100 billion a year in administrative costs that are now inherent in a 1,500 private insurance company system. So those are the very serious differences that exist between the different concepts.
Bernie, how do you get people to sign on to paying new and more taxes for this, in light of the fact that there are a lot of people now who are barely skating by.
Big-
And say, I can't afford any more taxes.
But Andy, here is the point. That's a fair question. What I am suggesting, unlike other programs, unlike the Republican program, unlike the Democratic leadership program, is the proposal that I am pushing forth will not cost the American people or the people of the state of Vermont any more money than we're presently spending. You're talking about, oh gee, we don't want to pay more taxes. Of course we don't want to pay more taxes. This year, unless we bring about a single-payer system, we're going to be spending an estimated $130 million a year more for health care in the state of Vermont. So you may have a legislature and a governor who say no new taxes. That's great. But $130 million more on health care is not good. And what we have got to understand is that what difference does it make if my health insurance premiums go up by 15 or 20% this year, if I'm a business person, if I'm an individual, if my co-payments and deductibles go up, if I'm a senior citizen? Gee, my taxes haven't gone up. No kidding. My health care costs have hit the roof. And what we have got to understand is that health care is a basic necessity of life. All of our people require it, and we've got to control those costs. So what I'm suggesting, yes, of course, there will be a shift from health insurance premiums to the tax base. There's no question about that. But what I am suggesting is that approach is the only effective way of controlling escalating healthcare costs. And more people are understanding that. For example, I was delighted to see last weekend, I think it was in the Free Press, where a poll indicated that 61% of the people in the state of Vermont want a single-payer system. National poll after national poll suggests that the people of this country understand that healthcare is not free. Yes, they're going to have to pay more in taxes, but their health insurance premiums are going to go down, their out-of-pocket expense goes down, their deductibles disappears, their co-payments disappear, that on the long run, the vast majority of the people gain from that.
What kind of sentiment is going now on the House side on your
In
plan?
Congress,
Yeah.
there's a split. The split is between those of us, I would say 25-30% of the Democrats support the single-payer concept. The division there is whether that program should be administered at the national level, at the state level. Marty Russo of Illinois has a good bill. He would administer the program from the national level. I would administer it from the state level. I would say 25-30% of the Democrats support that. Republicans are supporting a variety of programs, none of which I think will have any impact in providing quality health care to all people. I would suspect that the House leadership, Foley, Gephardt, and others will end up supporting the Kennedy pay-or-play plan.
I have a question on another
Sure.
matter.
Well, let me stay on healthcare, and then I'll get to another matter. Anything else on healthcare? Okay, let me just conclude by saying, I would hope, and I'm delighted, if people need more information, I have oodles, more information you'd ever want to see on the Canadian system, on our system. This is an enormously important issue, and, if you need any more
Do
information.
you expect any action in the House within the year or so? Or
Yeah, I think that
when do you think it'll go to committees?
well, it's
Sit
in
down and
committees.
start-
They are in committees right now.
Hash this thing out until we get
They've been
something
hashing it
concrete.
out. I mean, they've been doing it. The question, as you know, the decisions made in Congress are made by the Democratic leadership. They ultimately will decide what happens. I think from a political point of view, they are debating now whether they want to punish Bush politically by just letting the Democratic candidates talk about health care and not do anything until after the election. That's certainly one line of thinking. Just use it as a political football. Other Democrats want to go forward with either the pay-or-play or single-payer system. I don't think it's been determined whether or not what will happen. I don't know that they know yet. I'm sorry, yeah.
Any great expectations for the president's speech tomorrow night?
No. I think it is
George hasn't called?
very clear, and I'll have more to say about this after I'll be leaving for Washington tomorrow morning, and I'll be there. On the major issues facing the country, number one, a single-payer national health care system. Clearly, the president is tied into the insurance companies and the drug companies and has nothing significant to say about the crisis in health care. In terms of real tax reform, which asks the rich to start paying their fair share of taxes so that we can lower taxes on working people in the middle class, the president will have, I believe, nothing significant to say about that. And in terms of major cuts in military spending so that we can rebuild America and provide decent jobs for our people, the president actually is beginning to move a little bit on that, but I don't know that he'll go anywhere near far enough. But who knows? He is falling rapidly in the polls, and when a politician falls rapidly in the polls, you never know what he or she may be saying. So we will be watching the speech with anticipation.
Bernie, on another separate issue, there's a bill floating around Montpelier that would allow, change the US Constitution to allow states to regulate campaign spending.
Yeah, good. No, there's...
Good idea?
Sure it is. There is the issue of campaign finance reform is certainly one of the most important issues that we have got to deal with as a nation. It is unacceptable that people with large sums of money can buy elections, that wealthy people continue to dominate the political process. Most importantly, there must be a lid on the amount of money that can be spent in an election. I have played some role in trying to get something through the House that has not gone as far as I would like to see, but perhaps we are making some progress. So any way that that issue can be tackled is important.
Do you plan on agreeing to campaign?
Well, when I
spending
begin the
limits?
campaign, I'll be happy to talk about that issue.
Do you-
But as I said, no, I'm
If
sorry.
you're- if
Not
you're gonna-
sorry, Andy, every time we're here, you ask me questions about the campaign. And I've told you many, many times that I think the people of this state and country do not want to see a 10-month campaign. My views on campaign finance reform are very well known. I believe in it. But I am not going to get involved in a campaign for 10 months. I'm not going to do it.
When's the
But if
campaign
you're going,
start?
When I begin it. And I will begin it within several months.
but Bernie,
Yeah, I started my campaign in April, when I ran for re-election. That was probably too long a campaign. But I will not be starting the campaign in January. I will not be dealing with those issues until I start it.
but if you're supporting campaign reform and you then won't accept it in your own campaign,
I did
isn't that
not.
being hypocritical?
I didn't say that, did I? What
But
did I say?
I'm asking for a position
No,
on
I
it.
said that I do support campaign finance reform. I do support limitations on the amount of money that can be spent. But I will not be beginning my campaign 10 months before Election Day, because I think that is one of the reasons that makes Americans disgusted with the political process. Campaigns never end. And by the way, I think the media has to accept its share of that responsibility for never ending that stuff. I do not intend to begin my campaign until I begin it. And when I begin it, I will deal with all questions raised about politics and the election. All questions, including campaign spending. That is a fair question. I've never ducked away from that. In fact, I believe in that. But I will not begin the campaign now.
What's an appropriate amount, would you think, for,
Andy, I just answered your question, and I really dislike, I've given you the best answer that I can give you. And that is, I believe in campaign finance limitations. I believe in campaign finance reform. Very few people in the Congress will fight harder for that. But I will not begin my campaign 10 months before Election Day. That is not what the people of Vermont want.
I'm
So I'm not
asking
going to
you to
give you...
campaign, I'm just asking for a dollar figure, if you think there's an appropriate dollar
Well,
figure
we'll-
for a congressional race.
I do, and we
Whether
will
you're in
deal
it or
with
whether-
that. What I should tell you is that in Congress, what has been passed through the House is a limitation of $600,000 per House district. I think that's too high, and I think we can go lower than that. I would like to see us go lower than that.
300,000, or?
I think this becomes silly.
I'm just trying to get some specifics.
And I said that we will be very specific. If you're asking me about my own campaign, I will give you those specifics. There'll be nobody
I'm asking you
more.
about a House campaign in Vermont.
I've
whether
said
you're
to
in it or
you
not.
that I think that $600,000 is what the House passed. I think that is too much, and I think we should bring it down. How much exactly, I can't tell you right now. Okay? Okay, thanks very much.
Thank you.